Hey you guys, this is our last week on the insight stage, so let's get started. This week we're talking about immediacy, and we're going to review the insight stage and give a few more tips about when to use what skills. So first, immediacy. What is immediacy? This can actually be a really important, really useful skill, but it's kind of high stakes. But this refers to when the helper directly discusses the therapeutic relationship in some way. So that makes sense. I'm immediately talking about the fact that I'm having a comment about what's going on in my relationship with the client. So this could involve asking the client how they're feeling about the relationship, or you as the helper saying how you're feeling about the client, how you're feeling about yourself in relation to the client, or how you're feeling about the relationship generally. This is also referred to as meta communication. So communication about your kind of communication in general in your therapeutic relationship. Immediacy is also related to disclosure, but unlike disclosures in the past where you're talking about your own experiences in life and how they relate to client experiences, again, you're directly talking about the therapeutic relationship that you guys share. So let's break this down and make a little more sense of it. First of all, it's important to understand that the therapeutic relationship is a microcosm. What do we mean by that? So I have a definition down there that a microcosm is a little world, it's a little community that is the epitome of a larger community or entity. Breaking that down, the way that a client relates to you, once you've built up a relationship with them and they're comfortable with you, they're probably going to start relating to you the way that they also relate to the people in their life. And so obviously sometimes people have defense mechanisms or unhelpful ways that they interact with the outside world, and that eventually comes in the relationship itself. And so by kind of referencing what's going on in your relationship, sometimes that can then lead to changes on the outside as well. So this is a very powerful intervention. It can promote a lot of insight about how clients engage in their interpersonal interactions. This usually does run into some defense mechanisms, so clients can react really negatively to immediacy sometimes, sometimes not, and sometimes they might react negatively at first, but it sits in and it sinks with them. So that's why it's just so important. I know I keep saying it, but you have to have warmth and have a really strong relationship in the insight stage, but particularly with immediacy, you really have to have that foundation or immediacy just won't work. So immediacy involves being in the moment with clients. We're not talking about things in the past, we're not talking about things in the future, we're talking about me and you right now. So there are a few different things that you can reference in immediacy. One is you could bring immediacy to how the client is feeling about the overall relationship. You might feel like you need to check in. An example of asking that would be, how are you feeling about our work together? Another type of immediacy could be referring to a specific event that happened in counseling or helping together, such as, how did you feel after the challenging session we had last week? Maybe you know that you brought up some difficult stuff with the client and you just want to check in and see how they're sitting with that. It could also refer to a particular present reaction that you or the client are having. So something that's happening right now in the moment that you want to bring attention to. You seem to react to what I said just now. How are you feeling? So checking in on something that's happening in the moment. Let's break this down with maybe a case example and look at a little more thoroughly different types of immediacy. So in this case example, let's say we have Joan, who's a 62-year-old counselor, and Amelie, a French citizen with American residency, and they've been meeting together for about 3 months. So they've done the exploration skills stuff, they know each other, they have a relationship. Joan noticed that Amelie was shy to counseling at first, but soon warmed up as Joan worked to build rapport and understand Amelie's feelings and experiences. Amelie tells Joan during their 4th session that she has never felt seen or cared for like she does with Joan. Over time, Amelie shares that she's unhappy with her boyfriend as he keeps telling her that she is icy. Amelie shares that this feedback really hurts her and that she doesn't think it's accurate for her. And maybe Amelie shares that she starts to kind of wall up, and maybe that's what her boyfriend is referring to when he says that she's being icy, but she doesn't really make that connection or acknowledge that. So Joan maybe begins, once they really know each other, to work on challenging Amelie to acknowledge ways that she might be contributing to her relational difficulties, once she starts to notice that Amelie tends to avoid taking any responsibility. Not to say that Amelie's experiences with her boyfriend are inaccurate, but when someone is completely blaming the other person or the outside situations and not taking any personal responsibility, that's usually a little clue that something's going on. So after a few sessions of trying to challenge Amelie, Joan notices that Amelie begins to shut down and wall up during counseling sessions. So Joan saw an issue, she tried to address it and challenge it, and Amelie is not having it, she's shutting down. What are ways that they can get through this? Because obviously if Joan can't connect with Amelie again, they're not going to be able to keep working. So she should use immediacy. Here are a few different ways she could do that. One is just open questions and probes about the relationship. So this involves, again, open-ended process questions like you've used before. These are directed to the client to get them to talk about their experience of the therapeutic relationship. So an example could be Joan saying, "So, I wonder how you're feeling about our session today." So that's referring to the current session. She could also do something referring to the larger picture, such as, how are you feeling about our connection right now? The next type of immediacy that Joan can use in this situation are a statement about helper reactions to the clients. So in this type of immediacy, the helper shares their own feelings or reactions to the client in the moment. And obviously this has to be done in clear therapeutic intentions. The reason for doing this is not to air your grievances and get your emotional needs met. You should do this because you think it's going to be helpful in starting an important conversation. So Joan could say, "I'm feeling a bit disconnected to you today. How are you feeling?" You see how she acknowledges her feelings, but she turns it back to the client. Or she could say, "I have to be honest. I'm feeling like there's a wall between us. Could we talk about that?" And notice the tone in which I just said that. She's not saying, "I have to be honest. I just feel like there's a wall. Like, what's going on?" She's not using a blaming tone. She's maintaining an empathetic, warm tone, but she's saying, "Hey, what's going on here? I'm not feeling great about things. I'm wondering where you are." The next is making the covert overt. So this involves when a helper brings up cues that they're seeing, when they feel they're receiving different things from the client that the client's trying to say, "Hey, I'm not cool with this," but the client isn't directly saying it. So the counselor or helper brings this up because they want to more directly explore what's going on. So this can involve saying something like, "You're looking away from me today. I wonder if you're feeling distant in our relationship." So see there, she's noticing a nonverbal cue, which lets her know the client is not engaged. Another example, "You seem distant from me lately. I'm wondering what's going on inside." So using that gentle, therapeutic, curious tone, but checking in on the nonverbals. And then the last one is drawing parallels with outside relationships. This can be a very useful skill, but spoiler alert, it's very easy to sound judgmental, so be cautious, but this can bring a lot of nice change. So in this type of immediacy, the helper is drawing connections between the therapeutic relationship in the room and dynamics that the client has with outside relationships. So an example of that, Joan might reference something the client has said about how she reacts to other people. Joan could say, "You've mentioned that you withdraw from your boyfriend when you feel attacked. I'm wondering, is that what's happening with me?" And so I hope we can understand that the point of that isn't to necessarily say that what the client is doing is wrong, or it's not for the therapist or helper or social worker or whatever to kind of get a one-up on the client. It's to explore the client's reactions, because people have patterns in how they react to people, and sometimes those patterns aren't helpful. And they can just be helpful clues for just exploring more and learning more about what's going on. So here are some tips for using immediacy. It may be helpful to explain your intentions for using immediacy. Obviously, it's a very direct way of talking that people in normal relationships don't tend to do, so it can be jarring, but if you explain that your intention is just to gain more understanding, to help the client understand themselves better, they usually will be more open to it, hopefully. If there are possible cultural differences, please address these. We remember some types of cultures, you don't address things directly, so bringing that up with the client, or perhaps there could be like gender roles going on. Someone comes from a culture where maybe women don't speak up their mind as much, and if you're a woman or a male helper working with a female client who has that type of culture, trying to normalize why you're doing what you're doing here, and maybe they won't want to engage with that, and that's okay. But if there are cultural differences, bring it up. Avoid should statements or advice giving here. You want to bring things up honestly and see where it goes, but we're not trying to gotcha our clients, right? Like when we're immediately bringing up some like funky dynamics that might be going on, again, it's all for the purpose of helping the client understand themselves better. We're not even trying to judge the way that they're reacting to us. We're just trying to bring understanding. So be very cautious with it, but be honest and compassionate. And like I said, respond from compassion and not anger. You're a person too, and sometimes clients might react to you in a way that you don't like or makes you upset. You have to kind of check those feelings and remember, how can I use these feelings in a way that's useful for the client? You can vent about it with your supervisor or your colleagues in an appropriate way later. And lastly, be prepared for client feedback. When you bring the relationship into the room to talk about it, the client might have feedback for you as well. What if you are acting in a way that's judgmental or makes the client feel uncomfortable and it's not about them, it's about you? So that could always be an option. Or a client could really not want to go there or be open, and they could just blame you and not have the self-awareness to see some of their own negative patterns. All that can happen. We hope for the best. We hope that we can just explore things rationally and compassionately, but everyone's different. So that's kind of it for immediacy. Let's take some time just reviewing the insight stage generally, looking at our goals for the insight stage and breaking down the skills and when you would use them. So we want to remember that the goal of the insight stage is to help clients develop new perspectives about themselves, their feelings, and their behaviors. It's not about advice giving, it's not about making goals yet, it's helping them understand things at a deeper level. The core belief here is that if a client has an improved self-awareness, it could lead to improved self-management and more dedication to personal changes. So in the action stage, which is next, when they come up with goals, it's going to be based on a growth in their understanding of themselves and can lead to stronger outcomes. So setting the stage, I just want to remind you one more time, I'm probably getting annoying, but the insight stage is only possible with a thorough amount of time and skill in the exploration stage because, first, the exploration stage helps build a strong connection that will be important in getting past those defenses that can come up in the insight stage. Defenses and blocks. Two, it allows the client to feel supported in order to go to some of these challenging places. Often places where people are stuck are challenging, emotionally draining, so they want to be able to feel like they can depend on you to go there. And lastly, it helps the helper get to know their client in order to come up with best fit interventions. There's really no one-size-fits-all in helping. We throw out different tools, but they have to be based on who the client is, where they are, how they work, what they're open to, etc. So when you're using the different interventions that we've talked about in the insight stage, there are different kind of markers or clues for when you know to use that skill. So for challenging clients, you want to see these things that will be a clue that you need to maybe challenge the client a bit. So if the client is ambivalent, and ambivalence means that you're kind of stuck between multiple roads or feel really strongly about multiple options, you just feel stuck, and you don't really have a commitment to one path. So if they're kind of waffling and wavering, challenging can be a way to get them to really realize what they're really wanting. If they're contradicting themselves a lot, discrepancies in client behaviors, like we've talked about, if they say one thing and do another, if they're feeling stuck. So these are all referred to as sour notes. These are things that just don't feel right. If you're having, if you're working with a client and the client isn't directing it at you, but they're within themselves, there's something just that feels off, those are the things you want to challenge because they're, the client is, it's almost like they're trying to put, a square peg in a round hole. It's just not working. So challenging can be a way to shake things up for them. Insight work, when do you use open questions and probes for insight building? Well, first, the client has to indicate that they're ready for a new perspective before you go there. If you try to ask them questions about insight and they aren't ready to go there, they're just going to shut down or not respond to what you're saying. You can't lead a horse to water, so they say. The horse has to be thirsty and want to go there. If the client keeps saying that they don't understand, but they're eager to understand, this is a place where a client is like, oh, I just don't get it. I really want to, but it's just not clicking for me. If they show nonverbal clues of distress because they can't figure out an issue. When someone's just like, oh, I'm just so tired of being stuck, or they're getting more and more anxious and you guys have explored a topic to no end, but you haven't looked at other clues yet. And if they're getting increasingly anxious, it's time to move into insight work. The client also may not be ready. It's equally important when they're not ready. If they are just asking you for advice and to fix it, that's not really insight. That's not them learning more about themselves. If they're just like, fix this for me, what do I do? That's not insight. If they're still blaming external sources, it's everyone's fault, it's the situation's fault, and there are times that obviously, other people or situations are tough. But if they aren't taking any personal responsibility, then they also aren't taking ownership or have any agency. They can't do anything about it if the problem is just outside. So if they're not taking any ownership, you're going to have a hard time doing this work, and you might have to go back to challenge or more relationship building to get them to be a little more open. Next, immediacy, the skill we just talked about. When do you use immediacy? When the client's acting in a non-typical manner that could be kind of funky. So it's, in the exploration stage, they were maybe open, things were building, and then suddenly they're acting different. And this could be, grabby and aggressive and clingy, or it can be mean or withdrawn or blocked, whatever. Anything that's like an intense affect. Are they coming on too strong? Are they pulling away too hard? What's going on? Is the client giving passive clues about their attitudes towards your work together? Again, this can be negative or it can be positive. They could think that you're their savior and you're there to help them with everything. That's not true. You have to bring immediacy to that. Or are they acting like you're a jerk for challenging them? And they tend to not like to be challenged. So those are the different things to look for. I like to think of it as like weird vibes, because if they're projecting things onto you, you're not going to be able to move forward. So immediacy is when there's something that's being projected that's funking things up. Another thing is kind of being aware of your reactions. That could be a sign that you're done with the exploration stage and you need to move on to insight work. These are your own feelings. So keep reflecting how you're feeling with clients. Again, it's not about attending to your own feelings and getting your needs met with the client, but using your feelings as a sign that something could be going on therapeutically. So this is if you're feeling bored, if you're feeling angry, if you're feeling stuck with a client, it could be time to move towards insight. Are you afraid to approach certain topics? Sometimes people give off clues they don't want you to go somewhere. And in helping, that's usually where you need to go. But if the client has set up all these walls and boundaries that you can't go there, they're probably doing that with other people in their lives. They're probably doing that with themselves. So that's a sign that that's something that could use some insight. And also, you might want to ask yourself, if you're feeling funky, what have you done? Are you maintaining a strong sense of empathy in your work, or has it gone off the rails? Sometimes insight work isn't about what the client needs, but it's actually your own insight. So if things feel off or funky in any way, see if it's about the client, see if it's about you, but attend to it, because you guys need to move forward together, right? And then lastly, are you in tune? That relates to, whether or not you're maintaining empathy. In the insight stage, it's easy to rush towards advice giving or, trying to solve things or fix it, but you can lose that sense of being in tune with each other and having a strong connection. You want to keep that throughout. So these are kind of the different steps for choosing, implementing, and maintaining insight skills in this stage. So first, you're selecting an intervention, and you're doing that by examining your intentions, your awareness of the client, and you might try something and see how it goes, examine the client's reactions. But first, you choose some skills, you try them out, you see how it goes. Next, you want to keep doing this work. Insight work takes time. You might try some of these skills and they're not going to get it right away. You're going to have to probably go back over some stuff with them, and it might take a while for them to really be ready to grapple with this. So keep an open dialogue about this work. Be immediate about the fact that you guys are working on building insights and it takes time, and don't judge them and don't give advice. And lastly, throughout the insight stage, keep following up, keep checking in. Like I said, it takes time. So keep asking the client how they understand things. When you finally get to a place where the client is really getting it, they're making new connections, they're feeling a lot of energy, that's when you're going to move into the action stage. But you can see this process from the exploration stage and, they're feeling ready to see things differently, and then the process of helping them do that until they really have an understanding, and then you can move on to start making goals for change. And then lastly, we're just going to go over quickly common mistakes in the insight stage. Some of these popped up on the quizzes, and we hadn't gotten to common mistakes yet, but you might see some of these that you may have done or you could ever see yourself doing, and that's okay. Mistakes happen. Here are the common ones, though. The first is moving too quickly into insight work. Again, that has to come with a strong relationship, a strong background. You need to know a lot about the client to move on to insight. So don't go too quickly into this. But next is taking too much responsibility in developing client insight. Yes, we want clients to gain insight, but it's not our job to change their world and fix everything. They have to be willing as well. Insight work is hard work, and if they don't do it, it's not going to happen. Getting stuck in your own perspective, being too rigid. The other thing that's tricky about the insight stage is that we're trying to have a sense of what we think needs to change for the client, and a lot of time that can come from our own training and theoretical perspectives, but we might not always be right, and that's okay. So you want to have some thoughts and ideas that come from your training, but you don't want to hold them too rigidly at the same time. It's a balance that takes time. Forgetting to remain empathetic and person-centered. Again, you have to maintain empathy and stay centered on your client the whole time, or otherwise you're just another schmuck who's telling them what to do or getting up in their business. Next is taking clients at face value and not digging deeper. Sometimes as helpers we want to rush to solutions and making sense of things, but also clients might do that too. So don't be afraid to dig a little deeper. Use those open-ended questions and probes and really get to what they're thinking and feeling. I've talked to some of you about you don't want to stay on the top. You want to go deep, dig deep, stay with things longer than you might have instincts to at first to be sure that you're really making real connections here and not looking for quick fixes. Next, forgetting that not all clients need this work. Some clients just need to feel heard and seen. Sometimes clients just need to go talk about it, and that's all they need. They're going to make those insights on their own. So sometimes clients don't need us for that, and that's okay. And lastly, unchecked countertransference. What do I mean by that? There's a lot of disclosure in the insight stage, right? Of, connecting to your own experience and thoughts, and that can be a helpful tool. But your clients aren't you. So you just remember that what they need or what things mean to them aren't the same as your experiences. So you use that as a tool, but again, you don't want to hold that too rigidly. You still want to understand that their experiences could be totally different. So that is kind of the end of this module and this lecture. Read really closely. The discussion board is going to center around the longer dialogue that is at the end of the integration of the insight skills stage. And next week we're going to move on to, or next time we meet together, we're going to move on to the action stage. So see you guys soon. Hope you're well and have a happy Thanksgiving.